don't trust everybody with a white coat on.
House Democrats have announced an investigation into whether the Trump administration used the Paycheck Protection Program to undermine Planned Parenthood while paying out millions to a network of fake clinics known as crisis pregnancy centers, which present themselves with all the appearances of a healthcare facility, but are nothing of the sort.
CPCs and any other anti-abortion centers or fake clinics are run simply by volunteers, religious volunteers that, spend their time going in there and talking to you about God. So they seek any way to misinform people seeking abortion and healthcare services away from that, really with just the end goal for you to walk out of there shamed and afraid to access abortion. So often you'll see them in neighborhoods that are low income. In my neighborhood in the Bronx, in Mott Haven, there's one around the corner from my office. In communities of color, whether they're targeting Black communities, Latinx communities, low-income communities.
Meanwhile, the same Small Business Administration has demanded the return of $80 million given to local Planned Parenthood affiliates, which they qualified for under the stimulus relief. The SBA claims that they must return the money because of their association with the Planned Parenthood Federation of America. The National Federation was barred last year from receiving federal funding for family planning by a Trump executive order. The Planned Parenthood local affiliates used that $80 million to operate through the lockdown, in which they continued to provide healthcare services. To return it would potentially bankrupt many of them. So in essence, the SBA is working to shut down a vital healthcare provider in the middle of a pandemic.
We've seen this administration and previous administrations and legislators in statewide and federally efforts to completely get rid of Planned Parenthood. Planned Parenthood is a service provider that doesn't only provide abortion care, but life-saving services to poor communities. And it is very apparent to see that legislators in particular states, federally, locally, and statewide, their efforts to shut down Planned Parenthood.
There's an obvious double standard here and a clear ideological basis, since anti-abortion organizations like the American Family Association and the American Center for Law and Justice have received millions in relief funds and for quote-unquote family planning services. An estimated $4 to $10 million were handed out to organizations that run crisis pregnancy centers, of which there are some 4,000 nationwide. Organizers have been fighting to expose and shut down these fake clinics for years.
We have had some advancement with a research study to basically research and study the impact and harm of CPC's fake clinics in our communities. This is a really big step forward in the right direction to have the state assembly vote in favor of passing this research bill. All of the people that work in fake clinics, CPCs, are not medically trained. So we are a part of the Pro-Truth New York Coalition, which provides a manual, basically 5 steps to not get played by a CPC. And one of those being, don't trust everybody with a white coat on. It doesn't mean that they are a doctor. Oftentimes the people who staff these anti-abortion organizations or centers are just religious people that are anti-abortion.
One example of such groups is the Obria Group, whose CEO, Kathleen Eaton Bravo, warned in 2015 that when European nations, quote, accepted contraception and abortion, they stopped replacing their population. Christianity began to die out, and with Europeans having no children, immigrant Muslims came in to replace them. Yes, this is the same organization that has received millions in federal funding and that the anti-choice movement is holding up as the alternative to Planned Parenthood.
And it's quite shameful, especially when we're considering such essential healthcare services that are needed during a pandemic. How shameful is it for them to try to shut down a clinic and an organization that provides such important preventative care to poor communities? So for me, I would say that this is just in line with that continued threat and continued attack on Planned Parenthood.